Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, if you've watched this show before, every week I have a different healthcare professional on the program where we talk about services and programs available to you that I think will be of interest for you and your family. So stay tuned. I've got a great guest on the program. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Lisa Gewecke. Hi, Lisa. Thanks for being on the program.
Thank you for having me, Jamie.
Now, you're the marketing representative,
yes.
Is that right, for Altius
For
Healthcare.
Altius Healthcare.
And Altius, just for people who don't know, is the the company that KMC hired to manage our outpatient infusion center. Did I get that right?
That is correct. That is correct.
Good.
We have over 22 years of experience in the infusion industry, and we have partnered with Kingman Regional Medical Center to bring the excellence of these services to the outpatient center.
And that's such a wonderful gift for our community, because I believe in the past people either had to go like to the emergency room or to the cancer center.
Yes, exactly.
It wasn't easy to get the
It wasn't easy,
care they
and with
needed.
our emergency department here being so busy
Right.
at certain times, we're able to alleviate that flow of patients that simply need a blood transfusion. They simply need a dose of IV antibiotics.
You say simply need. That to me does not sound simple, but but you make it
Well,
easy
in
for them.
comparison to the complexities that are going on in the emergency
Right,
room,
right.
That would fall under simply. Patient comes in with the flu and they need a liter of hydration, say.
Oh, so you can do that
We
there
can
too?
funnel those patients into the outpatient center. We're staffed with nurses. It's a lot less stressful
I was just gonna
environment
say, it's
than the
less
emergency room.
stressful.
That's the way we like to look
Well,
at
and
it.
it's a more comfortable environment. I mean,
Absolutely.
I've been in your offices, and it's warm and as cozy as it can be, I guess, when you're hooked up to an IV.
Absolutely, absolutely. And some of our patients are there for a very long time. Blood transfusions can run between 4 to 8 hours, depending.
my.
And so we try to make it a very comfortable environment.
Okay.
We have nurses that are constantly monitoring those patients. So, you know, our goal is the best outcome possible for those patients.
So what kind of people, or not people, but what kind of illnesses require that kind of ongoing treatment?
Well, in general, the types of therapies that we see on a daily basis are those patients that are either receiving chemotherapy or have some other iron deficiency that would have them need to come to the center for 1 or 2 units of packed red blood cells. That's commonly what we see. Also, patients that are being discharged from our hospital to an alternate setting for IV antibiotics. Let's say they've been in the hospital treating MRSA or a C. diff or some other disorder, and the physician, they're otherwise stable and ready to be discharged from our facility.
Right.
But they're still going to require a 2, 4, or 6 week regimen of IV antibiotics.
Wow.
Those patients are then referred to us, and they commute to us on once or twice a day. And
A
come
day?
in. Yep, sometimes twice a day, depending on their
So are you 7
therapy.
days a week?
We are open, yes, from 8 to 5, 7 days a week. We have nurses
didn't know
staffing
that.
us, and at some point we hope to be open 24 hours a day.
Wow.
Yeah. So
Well, that, again, that's a wonderful gift that you have that facility here. And I had no idea that it was that intensive, or, you know,
well,
7
there are
days a week.
several patients, you know, within the community. There are a lot of specialty biologicals that have been developed recently for things like muscular dystrophy, multiple sclerosis.
Oh.
We see quite a few multiple sclerosis patients come in for either injectables or IV administration of their meds. Orencia, Boniva, some of the orthopedic drugs, that can be given simply as injectables. We offer injectable training.
So when you say
as well.
injectables, is that actually just like a shot, or is it they have a
Patients
shunt?
that are being asked to do a once a week or once a month injectable drug,
Okay.
they can come to us and we can train them how to administer their own therapy
Oh,
as well.
so that's a good thing
Yeah,
as
so we
well.
offer a very wide range of services to our community.
That's amazing. I did not realize that.
Mm-hmm.
So would that even be for someone like, say, who's diabetic, who has to learn how to give themselves
We can
insulin?
certainly offer diabetic
Okay.
training.
'Cause
Yes,
I think-
absolutely.
I haven't had to do anything like that, but I would have always thought that giving yourself a shot is, well, I don't want to give people shots either.
Well, and then and
all have our
alongside that
strengths.
too, our nurses are available to do a little bit more patient education
They have
as
more
far
time for
as
that.
diet and wound care and things to look for that they might recognize early on, and it doesn't become such a big problem in the end. So I
Can you
think
give
a lot
some
of times.
examples? What kind of things
Well,
would that be?
for wound care and wound management and what to look for clinically, generally diabetic patients are pretty well versed in their own care.
Right.
But
If they've had it for a while.
absolutely,
Right.
absolutely,
Maybe not the newbies.
right.
So that's another area where you could help with.
You know, we do have situations here on the other end of IVs and intravenous medications. There are a fair number of patients getting feeding tubes placed at KRMC. Generally, these are patients of our oncology center that are going to be getting radiation or chemotherapy for head and neck CA.
Okay.
Now, in general, the physician will place what's called a PEG tube or a feeding tube, and we're able to offer follow-up education to those patients
Okay.
so that they know how to manage and feed themselves with that tube.
Okay.
So-
So does that go directly into their stomach
Yes,
type
that's
of
a
thing?
tube
So
that's
it
placed
bypasses
directly
the-
into the stomach.
Okay.
So when they do get to a point in their treatment where they are having difficulty swallowing, they have that tube to back up on and can continue their nutrition needs.
So that's really important.
Absolutely,
Because
absolutely.
I didn't think about the fact, but when you're working on the head region, the throat, it
Yes.
impacts being able to swallow. You can't eat, and obviously you need to eat to get nutrition
Absolutely.
to keep your strength up to help fight the disease.
You know, and there's a fair number of therapies out there that physicians are prescribing for their patients that we may not even be aware of at the center. So if there are patients out there in the community that their doctor is asking them to self-inject a different type of biological, or they want them to have an IV therapy, they can always call our center and ask if that is a therapy that can be done on an outpatient basis.
Versus coming into the hospital.
Versus coming into the hospital, absolutely.
So I would
They
think
can
the
always-
expense, I mean, even if you have insurance, your co-pays and everything else are higher when you're a patient,
Yes.
the inpatient.
The
than-
outpatient infusion center is definitely a more cost-effective way to
Right.
receive your care.
That's
And
good to know.
absolutely.
Well, we'll mention this a number of times, but the phone number that people should call. Do we-
Here locally, it
Uh-huh.
is 928-263-3800.
Oh, that's an easy one, 263-3800.
Yes, or you call the hospital and ask for extension 3800.
Okay, and they'll transfer you over.
Yes.
Very good.
Yes.
Well, we'll mention that a couple of times on the program today because I just want to make sure people know the number to call if they have questions.
Okay.
But now, obviously, someone can't just walk in and off the street with their whatever they're supposed to get and go here.
Although we have had that happen.
Oh, you have?
What we like to do is work directly with the physician's
Sure.
office or with our emergency department staff.
Okay.
And they will identify a patient that has presented at the emergency department for, say, a blood transfusion.
Mm-hmm.
And in general, the emergency department staff will refer them to us.
Okay.
They will either fax the order and they will make us aware that there is a patient that's coming over to us from the emergency department.
Okay.
Most often, though, we do receive calls directly from case management
Okay,
within
sure.
the hospital,
As part of the
stating that
discharge
they have a
process.
patient, they are discharging on IV antibiotics,
Mm-hmm.
they will be, placing their access device at the hospital,
Mm-hmm.
and then we coordinate with that patient to start the very next day they will start coming in to us
Right.
for their course of therapy.
Okay.
That's pretty much the second route of referral. The third would be, in what I mostly do in my job, is market to the physicians in the community, also in the Havasu and the Bullhead, Fort Mojave area,
Okay.
that the center is here and available to their patients. And so we often get direct referrals from just patient offices.
Okay. So,
So-
patients come up from Havasu and Bullhead too?
We have patients that
Oh.
travel from Bullhead for their therapy and from Lake Havasu as
I
well.
didn't realize that.
Well, the resources are not available in those areas just
That's
yet.
good to know that we have.
So-
Again, you know, people just don't realize how fortunate we are in Kingman that we
And
have.
often, exactly, and oftentimes it becomes a reimbursement issue. And there are many therapies, such as IV antibiotics, that are not covered by Medicare in
Really?
the outpatient setting. And by outpatient setting, I mean in the home
Mm-hmm.
or in the nursing home. But if it is done in an outpatient setting that belongs to a hospital, so if it's a hospital's alternate site of care,
Okay.
it is reimbursed by Medicare.
Which is what we have here.
Yes, absolutely.
And that kind of answers my next question, because I was going to ask you, do you have patients who can't drive or can't walk in? Do you go to their home? But
Yeah,
if
generally
not-
we have to, in private insurance, private and commercial payers,
Mm-hmm.
in general, will pay for home infusion therapy at home.
Okay.
But
So
what's
do you have
nice
an
about
arm
this
that does
is,
that? I'm
Par-
sorry. Do you have a nurse that does
yes,
that
we have
then?
a full staff
Okay,
of
that-
RNs, specialty pharmacists, pharmacy techs, delivery mechanisms. We have
Okay.
couriers, so we are able to service patients in the home setting.
Okay.
But for the purposes of Kingman Regional,
Right, we
we're
try to
here
do
to
it.
manage this center and make sure these patients get the best care.
Right. Well, and you touched on this briefly at the beginning when we talked about how this also helps relieve some of that congestion, if you would, in the emergency room. Because
Absolutely.
we have gotten so big and so busy. And I know that, we're looking at expanding the emergency room over to the Wallapai Mountain campus here, hopefully by the end of the year, just to help, again, alleviate some of the
Exactly.
numbers that we're seeing. But as we've gotten bigger, the community's gotten bigger, and over the winter it was certainly a challenge for them because we had such a heavy flu epidemic through the community, and so it's great that we have Altius here too.
Well, and I think as we see the future of healthcare, as things are transpiring, we are going to see more and more of these alternate types of services where our healthcare organizations, as it were, need to be working together like spokes in a wheel. And it's not just about that emergent type of care in the emergency department anymore. It's facilitating those spokes of care out to those designated providers, which is going to create the best synergy of healthcare that we'll be able to provide.
And what's best for the patient.
Exactly. That's the best way that I can explain it.
Yeah, that makes a lot
is
of sense.
To pull that off of the emergency department and put it in a more appropriate spoke of care is the way I would explain
Right.
it.
Well, because then that frees them to deal with the true emergent care, whether it's an automobile
Absolutely.
accident or a heart attack,
Yes.
things like that, versus those that can walk in. And I guess I hadn't realized that in the past, before Altius came, then that is what people did, right? They just
Yes.
had to walk in. Did they make an appointment with the ER saying,
No,
I'm
the physicians were calling and just sending the patient to the ER with a prescription.
Wow.
Here, I'm here for my blood transfusion. And,
Wow.
and by and large, they're a complex therapy to complete. The patient has to be type and cross-matched. Once that is done, they could wait for 1 to 2 hours
Wow.
before their transfusion even begins.
We're going to take a quick break, and
Okay.
then we'll pick up where we left off and talk more about that.
Okay, great.
Okay, we're just going to take a quick break for messages. We'll be right back. Welcome back to Your Health Matters. My guest today is Lisa Gewecke with Altius Healthcare. Thanks again for being on the show,
Thank
Lisa.
you for having me.
We talked briefly before the break and a little bit during the break about the types of people that are going to need this infusion. and before the break, we were talking about when someone used to come into the ER to get this kind of a service. And it dawned on me, you mentioned earlier, 4 to 8 hours sometimes that they can be hooked up. So that would really, I mean, that literally takes a bed for a day almost.
Yes, it does.
For the ER.
Yes, it does.
So you're freeing that bed in the emergency room by having that patient come to Altius.
Absolutely.
Okay.
Freeing up those valuable services of our doctors, our nurses, and our professionals that are, trying to care for those emergent needs.
Right.
While we are highly equipped to handle those blood transfusion patients and some of the more lengthy infusions.
Okay. Now, I was thinking here on the show, just our regular viewers are thinking, well, I don't need that. Maybe not today, but it could impact loved ones, friends, and family in the future.
Yes,
So
you may be viewing the program thinking this has nothing to do with me, but then lo and behold, the next thing you know, a friend or a child, a relative, or even a neighbor or loved one, you may be in a discussion and find that they have multiple sclerosis or osteoporosis, or may have a diabetic ulcer on their foot. Any type of therapy where you would present to your physician's office, especially with chronic illness, such things as immune deficiencies. We don't see it here in the Arizona desert so much, but Lyme's disease.
Oh, yeah.
There are therapies available for Lyme's disease as well.
Did not know
So,
that.
we just never know what's going to walk through our door. But typically, for the viewer, it's an awareness that,
so
it
when
could
the
come
time
at any time.
comes that they need it.
It could come at any time, and just to know that the services are here and available to them, whether it's an injectable drug, whether it's a feeding tube, a blood transfusion. We're getting many of those patients from our local oncology center.
Okay.
They're receiving chemotherapy, their red blood cells are being depleted and they're weak. So that again is that lengthy therapy that is time consuming.
Right.
And really takes a lot of the valued staffing away from the ER. So we're able to just give that quality back there.
That's great. That's great. And you're sharing that, again, from someone who wouldn't know necessarily what to do, that they could be just handed a script by their doctor, whether it's here in Kingman or outside of Kingman, where they're getting service, that you need to get this injection once a week, or you need to have this transfusion every other day, whatever. So we're going to set their mind at ease that they have this infusion center to go to, and they can call you.
Absolutely. And if I've done my job,
if
I've done my job in the community, hopefully they won't be handed a script and told them to go,
just
flail around and find their services.
Okay.
I visit each and every doctor's office in our community at least every 2 weeks.
Wow.
I'm in and out of our hospital, up and down the floors, making sure that each of our healthcare providers in the community are aware of our center, how to contact us, what we can do for them.
Great.
So that is my role in the community.
Okay.
I also present at health fairs and the chamber mixers. So, and I've had quite a few people come and tour the facility because they just weren't sure what we did there.
Right, yeah.
So if they're ever in the medical building and just want to come in and take a peek, I'd be happy to walk them around the facility.
Suite 107, right?
Suite 107
right
in the professional medical building.
Right, very good. And the phone number again?
928-263-3800.
3800. And it's Lisa, so they could
Lisa,
call and
yes.
ask for Lisa if they have questions.
Absolutely.
And you're marketing, as you mentioned, to the docs, and you've been doing this for a while because Altius, you said, you've been 4 years.
I have been with Altius Healthcare for 4 years.
Wow, that's
Many
awesome.
in the community, especially our case managers here at the hospital, have seen me around for a lot longer than that.
Well, we're not going to go into years. That doesn't matter. You're just very experienced.
Yes, I've been in this industry for many, many years.
That's great. That's great. So pretty much your adult life, you've been doing healthcare marketing.
Healthcare marketing, yes,
That's
I have.
amazing. And Altius, now, are they out of Prescott, or is that?
Yes, our
Yeah,
home
home
office.
office.
We've we've been a home infusion pharmacy for over 22 years,
Okay.
based out of Prescott. We also had an office in Bullhead City at one time.
Okay.
But at this time, we are based out of Prescott, and we service through courier, and we work directly with the Kingman Regional Pharmacy.
So now when I'm sorry, I didn't
That's
mean to
okay.
interrupt you, but when you said you have a courier service, so are the drugs and all that in Prescott?
Yes, many of our meds are transported here from our Prescott pharmacy.
Okay.
And we do have a satellite pharmacy in Havasu. So occasionally there will be a situation where it's a same-day dosing schedule. And we are equipped to provide services for those cases.
Okay. So like if you do get a script that walks in that needs something, right, you're able to call
Yes.
one of those two usually, or call our
Absolutely.
pharmacy and get it over pretty
Yes.
quickly.
Absolutely.
That's amazing. Now
Yeah.
you actually yourself personally live in Havasu, Havasu.
Yes, I'm a resident of almost lifetime of Lake Havasu City, and I
You come
cover.
up to Kingman to cool off? And
Yes, I travel here twice weekly, and I travel to Bullhead twice weekly. So
Okay.
I like to consider myself a road warrior.
There you go, a Tri-City resident. You're all over the place.
I cover all of Mojave County and to Parker, actually.
Oh my goodness.
Yes.
I didn't realize that. So you go the hospital in Parker as well? Do they have an
Yes.
infusion center there?
They have a little clinic out
Okay.
of La Paz, so they're able to service some of their patients. But
Okay. Otherwise, though, I mean, so you're saying small. Do they have patients? Where do they send their patients? To ER?
they have kind of an ER clinic set
Okay.
up there, and they're able to do that. But we like to say at Altius we cover the whole state of Arizona, rural or otherwise. If it's in Arizona, we will find a way to provide the services.
Wow.
Yeah,
That's amazing. So
Yeah.
Flagstaff and all the
absolutely.
corners.
Yes.
That's great. Now, what do you do for fun when you're not traveling all over the Tri-City or the
Well,
county?
I live in Havasu, so
a river
you'll
rat?
find me on the water. If I'm not working, I'm on the water.
Very good, very good. I tease people all the time, you got to come up to Kingman to cool off because it gets a little hot down there.
And I enjoy it up here
Yeah.
as well. Yes, absolutely. Yes, either off-roading in the desert or boating on the lake. I have two sons that love to fish and ski, and
Very
so
good.
that's what we do. It's a great
Keeps you
life.
busy. Very good. So we were talking earlier about the hours of the clinic, that you're 7 days a week, 8 to 5. Do you have emergency situations?
Absolutely,
that
and
happen?
that's why I would say we are available 24/7.
Okay.
We have a triage nurse that is on call that will
okay.
answer any after-hours calls.
So what
And-
kind of emergencies would be an example that you'd get
Well,
called for?
occasionally there can be situations with their lines. Most of these
okay.
patients have what we call PICC lines,
Okay.
which were our peripherally inserted catheters.
Easy for you to say.
Yes. So we like to call them PICC
Yeah, I
lines.
see that.
Many patients have ports. So
Okay.
generally, if they're going to have any questions, it's going to be either reaction related,
Okay.
which could be fever, rash, hives, anything like that. Or they could be line related. If their line is bleeding from the line or anything like that. And our nurses go over with any of those symptoms with them at the center, and they leave the clinic with our pamphlets, our contact information, and how to reach us 24/7.
So you're literally there
So-
holding their hand.
Yes,
all the
we
time.
are.
Yeah.
And
That's
what's nice
awesome.
about that is they're not coming back into the ER, they're not coming back to the hospital. They have a direct line to a registered nurse or a pharmacist to answer their questions.
Oh, and a pharmacist too can. Oh,
Absolutely.
that's great, because I would think that when you have those kind of situations, it's scary, even for
Yes.
family members too. So when you do that training you were talking about earlier, you train the family too, kind
We train the family on what things to look for,
yeah.
and on many occasions we have a special DVD that is broken down into everything from hand washing to line care to flushing their lines.
Okay.
Now that's more home care related when patients are doing their therapy at home.
Right.
But we send these DVDs home with our patients so that they can put it in their DVD player, go back to chapter 1 on hand washing or line care, and it'll show them if there
Awesome.
is something with their line to be concerned about.
Right.
And it just puts their mind at ease.
Yeah,
Because it can be
absolutely.
overwhelming.
I would think so. That's got to
Absolutely.
be scary. Lisa, thank you so much for being on the program
I
today.
appreciate it. Thank
it's
you,
a great,
Jamie.
and again, that phone number one more time, 928-263.
3800.
3800, in case people have questions.
Okay.
All right. Thanks again.
Thank you so
I hope you
much.
learned something new today. I did. We'll see you next week with another great guest.